Health, we have surgeon Dr. Shawn Obi. Good morning.
Good morning.
Good morning. Thanks for having me.
Andy's been, he hasn't been saying this on the air, but all during the breaks and before the show, he's been saying he's sick.
No,
He's
I'm not.
sick.
I just have a stuffy nose.
Oh, okay.
Yeah, thank
He
you.
gave me a fist bump.
Yeah,
instead of a
it's
handshake,
respectful.
So we're keeping it cool.
Right? Pretty
Yeah.
respectful. This is one of those topics that like some people are uncomfortable to talk about, right? Especially maybe men.
Yeah, it's a little taboo, the
Yeah.
concept of getting your colonoscopy for screening, and a little intimidating environment
Yeah.
for most people.
Yeah, well, we all have to do it. And I think it's a certain age that it's recommended that it becomes a regular screening.
Right. It's a screening tool just like anything like mammography for women for breast cancer. And it's an important screening tool, and actually the age of the screening just dropped to 45 not too long ago. So colonoscopy is our best measure to find colon polyps, which can then become cancers.
I was actually at Henry Ford last fall when you had a bunch of students in from Northwest, robotics students, because you are using robotics for a lot of your surgeries.
That's right, and that's a very common approach for treatment of colon and rectal cancers, along with other type of pathologies like lung cancer or even just hernias and your run-of-the-mill non-cancer type of problems. So a lot of great evidence to support using those technologies to minimize damage to tissues. We know it has a great benefit for length of stay, and for most patients they'll return to their normal function much quicker with those less invasive approaches compared with like a traditional open operation.
And when caught early, how treatable is colon cancer?
Yeah, fortunately with the advent of colonoscopies and our screening tools, we're able to catch most of our colon and rectal cancers are early stage and very treatable with surgery and good survival statistics. And it's not just surviving longer, it's also how long are you living without a cancer recurrence. And so it's so important to identify those early, much easier to treat.
This may seem like a silly question to you, so settle in. Is the only way to really find out is to get a screening? Is that really the only way to be able to get the results?
To get a diagnosis?
Yeah.
Well, there are other screening tools besides a colonoscopy. Some tests that will evaluate for blood in the stool. They're not as sensitive, and it doesn't have you don't have an option for treatment with those kind of tests. A colonoscopy not just identifies polyps, but can remove them at the time and sometimes avoid surgery for cancers.
And I think that's what a lot of men my age or 45 and older have discovered, that the doctor discovers something during the colonoscopy and then I think errs on the side of caution and removes polyps.
Right.
And then there's a biopsy of those.
Right. They send that tissue off to the pathology team, who then evaluates it for what type of polyp it is and what the chances that it would have grown into a cancer or whether there's cancer proper in there. And our treatments or surveillance, like future colonoscopies, sometimes depends on those results, how frequently you need them,
And not just men.
Of course.
Right.
No.
Yeah. What about family history? If you have family history, is that can that?
Yeah.
Would you suggest getting?
That's an important part of this, but most patients don't develop colon cancers from a hereditary origin. There are other factors too, like the type of foods you eat. Red meats in particular are a higher risk for causing colon cancer. Patients that consume too much alcohol, smokers, obesity, those are some things that increase your risks for any cancers, but especially for a colon cancer.
Are the colonoscopy exams, are they easier than they used to be? Are they changed?
Yeah, most of the unpleasantness with a colonoscopy is actually the day before prep.
Sure.
You're using the bathroom a lot to get
Yeah.
a clean out so that the gastroenterologist can identify, all the anatomy well and reliably find polyps.
You know the big thing of Gatorade they dump on the football coaches?
Yes.
You have to drink that.
Yeah, it's a real clean out.
Yeah,
Yeah.
that's good.
Yeah.
So you're really just you're angry the day before, and then you feel great when you're done with that. Is that what
The
you're telling me?
colonoscopy is the best part of it because they give you these special drugs.
Yeah, you're asleep for the whole thing and
Yeah.
really not aware of what's happened. And
How often should one get a colonoscopy? Say you go at age 4. Say I go when I turn 45.
It's a great question. And I've had patients tell me, well, doctor told me I didn't need colonoscopies anymore because I'm beyond age 75. Any change in your bowel habits would prompt a colonoscopy. Any new abdominal pains or unintended weight loss or blood in the stool, those are all reasons to have your doctor reevaluate for the need for a colonoscopy.
With robotic surgery, is the recovery and the healing, is that a faster and easier process?
Yeah, a much prompter return to your normal function. Much less damage to the tissue on the inside compared with open surgery and even with laparoscopy because you're using much finer or precise movements with the robot. It's been associated with significant less bleeding, and so all of those things tie into patient outcomes, not just length of stays or readmissions, but how well you feel afterward.
What are patients, how do they react when you tell them that this is the kind of surgery that they need? And in the case of using robotics and being in that OR, what kind of, how does that affect the patient?
Most patients are, I think, surprised or alarmed or concerned about the diagnosis itself and are eager for treatment because they want to get better. But it's overwhelming and a lot of information up front. But I think that my whole philosophy is to try and educate people as much as possible about what's happening with them and what to expect. And I think that helps reduce a lot of the fears. A lot of preparation goes into any kind of treatments, but especially a surgical treatment. We have a very defined strategy pre-op to help get them through the operation safely, and then intra-op, what happens in the actual operating room, and then the aftercare in the hospital and beyond. And if that's carefully constructed and people have the right expectation, they really do quite well most of the time.
Is this something that you've ever found in younger people, or is this traditionally?
We're seeing a lot of colon and rectal cancers in younger patients, and again, most of the time it's not a hereditary problem. I think some of it's environmental, and I think that we're exposed to all kinds of things in our environment at very low doses, so I think most people aren't affected by that. But if you have some of those risk behaviors like eating lots of red meat or have a lot of alcohol abuse or obesity, I think you're naturally going to be a little more susceptible.
Interesting.
Are there signs other than a colonoscopy that will alert you that you might have a problem?
Yeah, I think most people will start seeking attention when they start noticing blood in their stool, but I think any change in your bowel habits, and most people are very habitual about their bowel habits. You know, they go at a certain time of the day or a certain frequency, and when that starts to change, I think you have to really be attuned to those changes and ask your doctor if something's wrong.
Awesome. Well, we want to thank you so much for all the information and all the
Yeah.
great care you are providing right here at Henry Ford Jackson
Thank
Hospital.
you guys for the opportunity. Love the program.
Thank you. Dr. Shawn Obi, General Surgeon at Henry Ford Jackson Hospital. More of the show right after this quick break.